Hello friends, my name is Dr. Shaival Chandalia. I'm a consultant endocrinologist and diabetologist at Jaslok Reliance Hospitals and Denma group of clinics. Today we'll be talking about a question that a lot of patients have that they are sleepy during the day but they're snoring at night. So what could be the possible cause? So we'll discuss a little bit about sleep hygiene and a condition called as sleep apnea. Now, sleep serves an important restorative function for our body. One must feel well rested when one gets up. So this is probably the best way of deciding whether your sleep is adequate. You feel well rested when you get up. This may be more important than the actual number of hours of sleep one gets. Now, what about the term called as sleep hygiene? Sleep hygiene is the term one uses for conditions that should be prevalent for a good night's sleep. And these conditions are as follows. Create a good sleep environment, make your bedroom quiet, dark, and at a comfortable temperature. Second, establish a regular sleep schedule so you go to bed and wake up at the same time each day. Avoid stimulants like caffeine and other stimulants for about 4 to 6 hours before going to sleep. Exercise regularly during the day but avoid exercising right before bed. Wind down before bed. Start a calming bedtime routine about an hour before bed. So limit screen time, turn off electronic devices at least 30 minutes before bed. Eat well but avoid heavy meals and spicy foods before bed. Eat a light meal if you do eat before bed, and limit or avoid taking naps during the day. So if all these kind of conditions are followed, you should get a good night's sleep. But there are people who have a medical issue which can affect their sleep. So they may be sleepy during the day but snoring at night. Now, what is this a sign of? This is a sign of sleep apnea. What is sleep apnea? It is a potentially serious sleep disorder in which breathing repeatedly stops and starts during sleep. Other symptoms besides loud snoring and daytime sleepiness are: number one, episodes in which you stop breathing during sleep should be reported by another person or your partner. Gasping for air during sleep, awakening with a dry mouth, morning headache, difficulty staying asleep known as insomnia, difficulty paying attention while awake, and irritability. Now, there are two types of sleep apnea: obstructive sleep apnea and central sleep apnea. Obstructive sleep apnea is more common and occurs when the throat muscles relax during sleep, obstructing the airway to the lungs. So this is now very important cause of other conditions like increased blood pressure, even diabetes, due to this obstruction of your airway in the sleep because of relaxation of your muscles, your throat muscles. And it is important that this is treated. How do you diagnose and treat this condition? Diagnosis is by a sleep study, which is done either in the hospital or any other place which has the arrangement for this. And treatment involves a CPAP machine, which is that a mask is worn in the night while sleeping, attached to a machine which pushes air into the upper airway through the mask, thus keeping the airway open. So we must be aware of this condition, to summarize, and this condition should be diagnosed and treated appropriately. Thank you for your patient hearing.